It's another interesting episode of Feminine Scope, a program where we discuss issues affecting women, celebrating their triumphs, that covers different spheres of life and also seeking ways to solve their challenges. I am Amanda Ezekwe. According to the research carried out by the United Nations Office on Drugs and Crime, UNODC, 1 out of every 4 people who uses drugs in Nigeria is a woman. There is a great danger for the future of Nigeria because of the abuse of drugs and substances, which is on the rise amongst girls, especially teenage girls and women. This turns them into social miscreants and rebellious housewives, exposing them to a life of crime, prostitution, and sexually transmitted diseases. Some of the women addicts claim they abuse drugs and substances to escape worries caused directly or indirectly by marital problems or joblessness. Today on the program, we'll be discussing women and drug abuse. What is drug abuse? How can you identify an addict? How can they be helped? I have a guest in the studio. You'll get to meet him after the break. Please stay tuned. Welcome back. My guest is Ambassador Kenneth Anetor, the Executive Director of a New Thing International Foundation with almost a decade of experience in the non-profit sector. A certified trainer of United Nations Office on Drugs and Crime, he was awarded a certificate for understanding addiction, identification, counseling and treatment of opioid use disorder from Harvard Medical School. In April 2023, Ambassador Kenneth Anetor was appointed as an ambassador of the Federal House of Representatives Committee on Narcotics Drugs in recognition of his humanitarian and outstanding service to the nation of Nigeria. He has a diploma in transmental health and is currently enrolled in a transmental health master's program at El Rohin University, London. On the 25th of March 2023, Ambassador Kenneth Anetor was awarded the African 40 Under 40 Honorary Award for Drug Abuse Control in Africa. You're welcome.
It's a pleasure to be here. Thank you.
Quite a lot.
Well, thank God he has been faithful.
Okay, we're talking about women and drug abuse today. What is drug abuse? Because sometimes when people hear drug abuse, what comes to mind is, okay, the man, miscreant, forgetting that women too get involved in drug abuse.
Yes. First of all, I would like to thank you for this opportunity. I'm very grateful when the media gives us platforms to do sensitizations and advocacy like this.
You're welcome.
First of all, when we talk about drug abuse, let's define what a drug is. A drug is any substance, either naturally occurring or man-made, that once taken changes the normal behavior of the body. And when we now talk about drug abuse, we're talking about using a drug different from 3 things must be captured when we say drug abuse. 1, when a drug is taken without a doctor's permission. Let me break it down to the lowest. If somebody is feeling the symptoms of headache and the person feels that that is just headache, meanwhile it could be symptoms of something else, and the person immediately goes to go and get that Panadol that they have kept in the wardrobe, and they're like, I'll just take
like
one.
We always do.
Like people always do, not all of us always do. And the person goes to go and take one of it, and that person takes one. That is, without a doctor's prescription, that is drug abuse. Second thing that must be captured, even when the doctor has said, okay, whenever you feel like this, go and take this, that he has doctor's advice on how to take that particular drug, because the person has other activities during the day. The person is not like, okay, I'm meant to take one in the afternoon, I'm meant to take one in the morning and take one in the evening. I will not have chance again during the day. Why don't I just take the 3 I'm meant to take in the morning, afternoon and evening at once? That is drug abuse. Then the third one is when a person takes a drug that is not legal in the territory or in the region that is taking it. Some places, some drugs are illegal to take. Some places that drug is legal. Like in Nigeria, you can't be taking anything with codeine. There are some places that you can't smoke. Some nations where it's legal to smoke marijuana for medical purposes. In Nigeria, it's illegal to smoke marijuana. So if you're taking a drug that is not legal in that particular region or territory, that's also drug abuse.
For women, why would or what are the reasons, what triggers drug abuse in women? Because we can say women, yeah, take drugs, maybe there are supplements and all that, which is different, but now we're talking about, you know, abusing drugs. What triggers them? What are the reasons you think women take drugs?
There are a lot of factors that can lead to drug usage, to substance abuse in women, but I won't call it a moral issue, because a lot of people begin to misconcept that drug usage is a moral issue, and that's the reason for this year's theme for the International Day on Against Drug Abuse and Illicit Trafficking. It's meant to be people first. Stop discrimination. Stop looking at it as a moral issue like this person. There are a lot of risk factors that can lead someone to doing drugs. One of the risk factors could be parental usage. In the course that we took at Harvard Medical School, there was a study called Neurology of Addiction, and the professors proposed a theory that if someone's great-grandfather or the person's grandfather or the person's father had used a particular type of drug, you must understand that drug abuse or substance abuse is a chronic relapsing brain disorder that is characterized by a person going after a particular drug of choice, regardless of how it affects the person, the person's environment, and the society at large. So now, if someone's dad or his grandfather had used a particular drug of choice, it's a chronic relapsing brain disorder, so it affects the brain. A particular part of the brain can be damaged. And in the neurology of addiction, the studies show that those parts of the brain that are damaged can be passed down to another generation. Like
genetics?
Genetics, in such a manner that if someone that the dad or the grandfather had used the particular type of drug and it damaged that part and it was passed down, when the person would have that particular drug of choice, he would not feel the same effect as someone who nobody in that family ever did drugs. So if that person was to take alcohol, it would feel different to the person in such a manner that the person could become easily addicted after a while of usage. And that's why you hear the term that in that family those people are alcoholics. So someone that is already predisposed to this disadvantage genetically can easily become addicted. Other risk factors that can influence the usage of someone's drug usage could be the environment the person comes from. If the person grows up watching a lot of people in the neighborhood using drugs, the person would not think that that is actually bad. Another thing that could influence is someone could have a medical condition. There was a study that I read about. Was carried out in Pakistan. A woman that was doing childbirth pains. The woman was told by her mother that, you're having this pain. When I was having birth pains too, this was the drug I used, and the woman got addicted because of medical condition. There was another example that a professor gave at the program that I went for, and he proposed that there was a nurse that she was having pains, she was going through a sickness and she was having pains, and she understood how to inject herself, and because of the pain she was having, she started using the drugs. So there's so many factors that can push someone into drug usage. It's not, there's peer pressure. The person can be in the midst of people that are using drugs, and because of social pressure, wanting to fit in, wanting to be among, person can decide to begin to use drugs. So I don't always look at drug usage as a moral issue that this person is a bad person, this person does not have good morals. The person can grow up in the best place, have good morals, but can become sick and use drugs as a coping mechanism. Also, there's a study that shows that women in abusive relationships that experience intimate partner violence might turn to drugs as a coping mechanism in the relationship. So there are different things that can lead women into drugs.
Environment, is it part of it?
Yes, the environment that the person grows up in is part of it.
So for women, how can you identify an addict?
How can you identify an addict? Okay, there are different ways to identify an addict. And okay, let's that word addict is very strong.
Okay.
It's very strong. Let's look at the word that someone that has a substance use disorder.
Okay.
Yes, because there are stages in drug usage. There's the stage that the person is just exploring. Then there's the stage that the person is having usage, constant usage. If someone is using drugs, first of all, you would notice that the person that was close to you, there'll be a psychological change in the person. If the person was always that person that used to come close to you, always wanting to come close to you, whenever the person comes back after using the drugs, the person might be different, might not want to come close to you, maybe because of the smell, or because the person is already feeling guilty that they're doing what they're not meant to do, and it might affect their psychology. Secondly, if the person is using drugs, you will find drug-related paraphernalia around the person. You can't be holding lighter every time and telling me you're using it to light candle. You're using it to light candles everywhere. You can't be with needles and you're telling me that you're using the needle for what? Also, Rizla, all the other things that are associated with drugs. Also, you would find the drugs with the person. You probably find the drugs with the person. And if someone that was always calm begins suddenly to, this is not like serious, but this can be, it can be part of it. Sudden weight gain, sudden weight loss, erratic behavior. Someone that's very calm becomes erratic. If it's a student, the person drops in their grades, things like that. It's not like these ones are very solid, but it's worth exploring. Also, the person now every time wants to wear dark shades inside the house. Someone that was always cool, now every time is always wearing dark shades, always want to cover their face with a face cap, always want to put on a hoodie, just to, because when the person is doing the drugs, the person would most usually feel guilty and would always want to withdraw, sudden aggressive behavior. So there are a lot of things that someone can observe, but when you want to diagnose it, to see the person's level of drug usage, those outlines that I gave among the 13 questions are what you would interview the person with.
Can we say that the environment, that like in the home, has affected the girl child into doing drugs?
I would say that studies have shown that violence at home, people that experience violence at home could use drugs as a coping mechanism. Studies have also shown that women that came from families where family members use drugs are more likely to be trafficked and more likely to do drugs. There's a UN Women study in 2014 that suggests that. So when there's violence or when there are challenges at home, it's easy for members of the house to actually use drugs as a coping mechanism to try to forget what is going on at home.
What are the effects of drug use on the woman's body?
Okay, there are a lot of effects of drug use on a woman's body. First of all, there are a lot of inequalities when it comes to drug use and the effects on women. First of all, let's start with the common one. When a woman and a man sit down, if they were to sit down and say they want to have a drinking competition, the woman would be at a disadvantage. And the fact that the woman's body has less liquid as compared to a man, in such a manner that if they started drinking, the level of water in the man's body would dilute the alcohol faster than the woman's own, which means that the woman will get intoxicated faster than the man will get intoxicated.
Okay.
When you look at the data from drug usage, the effects of drugs, in terms of use of painkillers, a lot of women die more from using painkillers than men. When you look at the global study of alcohol, men tend to drink more than women, but in terms of alcohol related deaths, women are actually dying 50 to 100 times. Statistics is 50 to 100 times more than men. Yes, actually. In terms of smoking tobacco, a lot of women smoke less than men, but in terms of the death rate, it's almost the same thing among men and women. In terms women indulging in drug usage, in terms of the effects, negative effects, are most likely to get raped. Women using drugs are most likely to suffer from intimate partner violence, and most women that use drugs are most likely 3 to 5 times more to have gender-based violence at home, at their workplace, because of their drug usage. When we begin to look more into it, when we look at the statistics of HIV/AIDS, because most women that use drugs, generally people that use drugs, tend to engage in high-risk behavior. But in particular, the statistics show that women that use drugs were more likely to engage in sexual immorality and other things like prostitution. Statistics went further to show that the rate of STDs and HIV, the prevalence was higher in women that use drugs than in men, especially women that were injecting drugs, because most women that use drugs were more likely to use drugs with multiple partners. And the statistics, if I were to go more into the statistics shows that for every 7 people in Nigeria, 1 person uses drugs. Among every 5 people that are using, every 4 people using drugs, 1 is a woman. Statistics show that women go faster from casual drug usage to problematic drug usage than men, because as I said earlier, when women use drugs, especially ones injecting, they're more likely to use it with multiple partners. And such an example would be that if they were to have a gathering here and like maybe 5 people were using drugs and 1 was a woman, if the drugs in that particular place was to finish and there's no more drugs, the woman was more likely to get called to meet another partner somewhere. And when she goes there, although the drug usage for the people in this particular place has finished, the woman's drug usage would continue. And if it was to end there, the woman can go somewhere else, like that. That's what the statistic shows. So women tend to use drugs with multiple partners, and in such manner they go faster from casual drug usage, like just casual drug usage, to problematic drug usage, developing drug use disorder and other things associated with it faster than men. But in terms of the treatments in Nigeria, still talking about the effects of drugs on women, in terms of treatment in Nigeria, the UNODC study that was done among treatment centers in Nigeria showed that among the 70-something registered treatment centers that are recognized by United Nations Office on Drugs and Crime and NDLA, among those centers, 70-something of them, they might have increased since the study.
Okay.
Among them, it shows that for every 20 person that was treated, only 1 was a woman. So more women are getting... Is it
that they don't come in for treatment, or it's just them?
It opens this question up, and what it proposed was that women are not coming out for treatment because women face a lot of stigma because of their drug usage. Women face stigma from caregivers, the nurses, the attendants at the treatment centers, and women face a lot of stigma from their fellow drug users. They face double stigma. The fellow drug,
do it together.
They do it together, but when they are going for treatment, the men are like, I'm a man, I'm using drugs. You're a woman, so you want to use drugs. Yeah. So they face this type of intimidation. They also face a lot of stigma from their family members. Women will usually ask what happened to their children if they go into treatment and go into rehabilitation. And the stigma is so much for them. That's why we need to continue to reach out, as we're doing now, to begin to break down these mental barriers that people have created, that drug usage is a moral challenge, that this person is immoral because they're using drugs, when actually there's so many factors that could influence a person's drug usage, that could influence a person's habits. Maybe their parents use drugs, maybe they had a medical condition that pushed them into using drugs, maybe they are having challenges, gender-based violence, and it's making them to use it as a coping mechanism. So that's the importance of actually being here, to stop discrimination, put people first, stop discrimination, and work on prevention.
So you've been on the field, handling drug issues, drug-related issues. What's the most common kind of drug you've seen, or the one that is very common that people use?
You mean the most commonly abused drug?
Yeah, the most commonly abused
drugs. Okay, let me say commonly abused substance. Alcohol.
Okay.
Alcohol, alcohol kills more people than any drug in the world. Yes, and it's legal in Nigeria. In some regions of the world, it's legal. Or in Nigeria, where we are, it's legal. And the deaths compared to men and women, the deaths for women in alcohol is 50 to 100% more than men.
Wow.
Alcohol kills more people, and it's almost rarely available for anybody that has money in their pocket to buy.
So the illegal one.
The illegal, drug usages will be categorized per region. That some regions, because of their social, cultural context, they will particularly take on drug. That some regions, because of their religious beliefs, they will indulge more in one drug. Of course, in the north, you won't find a lot of people drinking alcohol because of their religion. Then in the south, because some of these drugs are tied to cultural events, you'll find people using it as a form of culture. There was a program that we did in Ebony. When we were having this program in Ebony, the program got so intense, the facilitator was speaking, we were facilitating the program in a region in Ebony, and as the program was going on, like, everybody was so serious. Then one of the honorable members was like, off the mic, off the camera, off everything. So we're like, sir, it's like off everything. So we offed everything. Oh, it's not say he has a question. So I asked, like, when they were small, when they used to do this festival, that there was this particular type of alcohol, this drink that they used to drink, that they would drink it and dance and dance and dance. He said, sir, is that drug abuse? He said, yes, that is drug abuse. His face was shrunk, like, so he has been abusing drugs. And sometimes this thing is part of culture, but these cultures can influence us negatively and can lead to so much.
Do you think there is enough awareness about drug abuse?
I believe there is awareness about drug abuse, but it's not about having information there. It's about putting the right type of information in the space. Because
for the honorable member to know that, look, for him to find out that he has been abusing drugs, you understand, not everybody would.
Not everybody would.
And being an adult, something he started from childhood, when he was a kid. So far, what do you think is the link between drug abuse and domestic violence?
Okay. Studies have shown that people that use drugs tend to engage in high-risk behavior. If I look at it from the woman's perspective, there could be infidelity, there could be mismanagement of resources, there could be not being responsible for the activities that happen in the home, which can push a partner into being violent. But there's no reason for a man to be violent to a woman, but this could actually push. But the studies have actually shown, and the facts are there, that when a person is using drugs, that there's likely for that person to experience intimate partner violence, whether in marriage or in a relationship. And studies show that people that use drugs, especially women, are more likely to experience gender-based violence 3 to 5 times more than someone that is in a relationship without drugs, either from when the woman is using or even when the man is using. My advice is that, and studies even show that women are more likely to cope with a partner that is using drugs than for men to cope with a woman that is actually using drugs.
Why?
That's the statistics. A woman is caring. She will take care of him. He might vomit, he might fight, she would clean him up. This. Well, studies show that if it's a man, if the roles were reversed, the man would not actually do that. The man would be more violent. I want to put the woman out. But we have to get people to understand that there are so many situations that could push a woman or push anybody into drug usage, and it does not mean that the result should be kick the person out or fight or beat the person. There are different ways that these things can actually be tackled. There are ways that these things can actually be handled.
Okay, we'll still discuss about how the government can help, but we'll be going on a break, and when we come back we'll talk about that. We'll be going on a short break, and when we come back we'll discuss how the government can tackle the issue related to drug abuse. Stay tuned, we'll be right back.
We are a nation blessed with people of diverse cultures, religions, languages, and opinions. It is ironic that we are now being ripped apart by our greatest strength, our diversity. We have allowed intolerance, insensitivity, bigotry, and nepotism to blind our vision of the greatness we can achieve working together as one. We may not have the same culture, nor religion, nor language, but we all belong to the same nation by the divine will of God. We did not choose to be Nigerians. Nigeria chose us. This nation is our divine heritage, and if we open our eyes, we would realize that what divides us pales in comparison to what unites us. And by the comparison and conciliation of our differences, we will grow until our differences disappear. Our unity cannot be willed by mere declarations, nor do we get unity by ignoring the questions that beg for answers. We must celebrate our diversity and debate our differences without fracturing our unity. Our strength is not in our numbers, but in our unity, because even the weak become strong when united. Nigeria unite.
This message is brought to you by Abuja Broadcasting Corporation, owners and operators of ASO Radio 93.5 FM Abuja, ASO Television DSTV Channel 392, Star Times Terrestrial Channel 127, Free TV Channel 507, People's TV Channel 285, and UHF Channel 38.
Welcome back. If you're just joining us, this is Feminine Scope, and we have been discussing women and drug abuse. We still have our guest in the studio, Ambassador Kenneth Anetor.
It's a pleasure to be here.
Interesting discussion so far, but I want to go a bit personal. Why did you decide to be an advocate for drug abuse?
Okay. Growing up, I had challenges with drugs.
Okay.
Growing up, and our organization, in Youth International Foundation, was founded by 3 people that had challenges with drugs. And in those challenges, I had been expelled from schools. I was expelled from my secondary school. I was expelled from one of the universities I went to. I went to about 3 universities, and I kept having challenges until God was able to help me focus. As soon as I left the university, I realized that there are a lot of youth, a lot of young people that would have similar challenges with social vices that would not allow them to be productive to themselves, their family, and to the society. So I discussed with a couple of like minds, like myself, Nnamdi Wokiafo, Sere Gold, and we came up with this organization almost a decade ago to begin to reach out to youths. And in the last decade, I believe that God has helped us to do a lot. We've had programs, we've worked with the United Nations Office on Drugs and Crime, we are partners with the NDLA, we worked with the First Lady during the last regime, and even in this administration, we're looking to understand how, we understand that His Excellency Bola Ahmed Tinubu had plans for primary health care in his manifesto, but we are hoping that there will be a way that they will capture something for drug users. What's the plan for drug users? Is there a way that we can have women-focused treatment centers? One of the challenges that women face is that women's treatment needs are different, more specific than men's treatment needs in rehabilitation. That's why sometimes women don't even come out of this challenge of drug usage. So I'm hoping that this administration would have a plan to meet this issue of drug usage among the teeming youths, among the women in Nigeria, and that's our prayer.
We'll still go back to the government related issues, but what do you think parents have been doing? Would you blame parents when it comes to drug abuse on children, especially the girl child?
You can't really point a finger on these challenges. The truth of the matter is that everybody does their best to bring up their child, and life is a journey. Sometimes the hurdles and the obstacles that we face in life are preparations for the solution that we are going to be in the future. Like, if I had not faced those challenges and gotten to the climax of giving up in life, I probably wouldn't have been this person that's helping other people today. Probably would have been in an office with the same nice suit doing something else. But those challenges were what drove me to what I am today. So I believe that life is a journey. Parents can do more in the generation where parents are doing a lot to keep their kids in school, to take care of things around. We can't put all the blame on the parents. Everybody has a responsibility to themselves. The children have a responsibility to be good children. The parents have a responsibility to bring up the child in the way that it should grow. So everybody has their own responsibility. The schools too have their own responsibility. Our organization does a program called DAYS, Drug Abuse in the School Environment. In that program, we equip schools with information and materials to curtail drug and substance abuse in the school environment. So schools are taking up the responsibility too. We have a program called TIPS, the Informed People Seminar. In that program, we do sensitization program for parents so they can understand what it is, what a drug is, what are the signs the person is using drugs, and how to mitigate before the thing comes to substance use disorder. But the most important that I think, especially in cognizance of this year's International Day Against Drug Abuse and Illicit Trafficking, is stop people first, stop stigma, and stop discrimination. I think the media have the responsibility, because the way that the media spins the story of addiction, they have to shift it from a criminal point of view. Everybody doing drugs is a criminal. That person is smoking, he's doing drugs, he's rolling with. Yes, those things do exist, but they have to begin to look at it as a public health challenge. This person has a health challenge. Remember, drug abuse is not looking at someone using drugs excessively. It's not just saying that this person is an addict. No, this person has a substance use disorder. And substance use disorder is a disease, is a chronic relapsing brain disorder that is characterized by a person going after a particular drug of choice, regardless of how it affects himself. It might be detrimental to the person, but the person is still going after it. It might be detrimental to their family and their family relationship, and the person is still indulging in it. It might be detrimental to the society at large, and the whole community is tired, but the person is going after it. So you understand that this person has a challenge, and this person is actually a bit sick. The person should be treated as a patient, not as a criminal. And the media has the responsibility. You guys own the information. The way you dish out the information will now determine the way us, the general public, receives the information. So I think the media is the one that has to stop stigma and stop discrimination.
What are we doing now? We are helping disseminate information about drug abuse.
Yes.
So we're doing well.
So you're doing well. I must applaud your efforts.
So now let's go to the government.
Okay.
What can the government do to help?
That's very good. In terms of intervention, in the intervention skill, there are plenty players in the intervention skill, and there are plenty activities along this intervention skill. First of all, there's the prevention in the intervention chain. Prevention is creating programs that can mitigate initial onset of drug usage. So we could have programs in primary schools. We have programs for primary school students. There was a program that we did in a school, Fontage in Abuja. The school later went to win an award for substance abuse, the quiz. The award was handed to them by the Vice President, Yemi Osibanjo, for showing the knowledge that they had received during the program. So we did sensitization. It was a one-year program that we did in the school for primary school students. We also did sensitization program for secondary school students. So those fall under prevention, equipping the teenagers with the right information. There was a training that the United Nations Office on Drugs and Crime did for us last year on drug education. What that training does, did was to equip us with information to go back to schools and give them facts so that the students can make informed decisions about their drug usage. So under prevention, we have those set of programs, secondary school programs, sensitization, go and talk to the students so that they don't go into drugs. Secondly, the government could take up prevention program as part of curriculum. The government could develop their own prevention programs and instill it in such a way that it's already, drug abuse is being mentioned in, substance abuse is being mentioned in curriculum, but they could increase it. The NDLA has a mandate to have drug-free clubs in different schools. While I was in Borno in Maiduguri in February, and I followed some of the officers, the officer in charge of drug demand reduction there to some of the schools. I watched him, I participated in the sensitization programs, and I watched him start a drug-free club in one of the schools close to the Show's Palace. So government has that part, and the government can do more of that part, but the NDLA can't do it alone. There are other stakeholders that must come across. Also, we have the sensitization. We can have sensitization program. National Orientation Agency can do more on drug abuse, to do sensitization programs in universities, can do sensitization programs in marketplaces, in mosques, can work with clerics, can work with religious bodies to make sure that sensitization is being done on the ills of drug abuse, because of the way it renders our youths very wonderful. There's also the policy development advocacy. Our organization, we already been working with the National Assembly, advising on impact projects for legislators, advising and helping legislators develop programs to do in their various constituencies. But now there are also ways that you can help and advise them in amendment of acts and create policies in the Ministry of Health, push for policies that are more people friendly, instead of policies that criminalize drug usage. Something like that, we could do more. Government can look into things that will encourage people not to feel that if you come out that there are challenges for you. Also, there's harm reduction. Harm reduction is understanding that this person has a problem and looking at how you can help him in that problem. An example of harm reduction is during the HIV, there was a time in the late 90s, that HIV was on the rise.
Yes. And
government went and they created an intervention, a harm reduction intervention, in which they shared condoms for people. And those condoms that they gave to the people reduced the transmission of HIV. So there are different ways that government can. Either government can actively participate in prevention, government can actively participate in sensitization, government can create policies. In some schools, the policy is that if you are caught with drugs, you are expelled.
Yeah.
Expelled to where? To go and be a problem somewhere else. What are the plans? We can improve policies. We can work more. Finally, rehabilitation. Rehabilitation in Nigeria, among the 70-something treatment centers that we have in Nigeria, rehabilitation is between the cost of 300 to 3 million naira a month.
So it's not cheap.
It's not cheap. 300,000 to 3 million naira a month. So looking at that, government can find a way to come into that space. Government can find a way to come into that space, because the truth of the matter is that if government does not come into this space, on the long run, we are going to have a challenge. I was opportune to sit down with one of the directors at the National Drug Law Enforcement Agency, and he was telling me that since they opened this toll-free line, the majority of the calls that I get are women.
Wow.
Women complaining about drug usage, challenges they have with their children, and that they have drug use challenges and they need help. These are women. And we must understand that women play a strategic role in our society.
Sure.
They are responsible for nurturing the next generation. I don't want to say that men are not responsible, but women
a huge
role. A huge role. I want to forget for women. Women play a huge role in nurturing the next generation, and more women are going into drug usage. Remember the statistics I said, women go faster from casual to problematic drug usage than men. But in terms of rehabilitation, for every 20 people that are being rehabilitated, only one is a woman. That means that women are not accessing treatment services, because women rehabilitation needs special treatment. Very good. So it now shows that a lot of women are using drugs and are living with it. Living with it in the sense that the children are going out, coming in, they're meeting their mothers doing the drugs, and some advocates, not like myself, but some other people that are not making impact are going to their schools to talk to them, don't do drugs. If you do drugs, you go mad. And the guy goes home and he sees his mother using the drugs. Meanwhile, the mother is able to meet all his responsibilities. You know, women are dynamic. She's going to wake up in the morning, do everything, set everybody, push everybody out to work, to school. She sits down, relax, does some chores, does her drugs. Next time, she's preparing lunch for all of them to come back. And in the evening, she's now relaxed, doing the drugs. And the child is watching, saying, they said this thing is bad. The woman is like, remember I said that there's statistics that show that women use painkillers and tranquilizers more. They abuse it more. And she's using these painkillers and tranquilizers like, I just need to rest. I just need to rest. In high school, there was a kid that started using codeine. And he said that he saw his mom using codeine. This is my own personal experience. He said his mom would take 2 bottles of Benylin every night. He said it's not bad. That was his justification. He said it's not bad.
Because he saw his mom doing it.
He saw his mom doing it. He said it's not bad. His mom would take 2 bottles of codeine every day. So this challenges, government has a lot to do, and government must not do it alone. The media has their part to play. Civil society organizations has their part to play. The legislators in the National Assembly have their part to play. The parents have their part to play, and the children have their responsibilities and their part to play to be good too.
Currently in Nigeria, which state has the highest use of drugs, illegal substance?
Well,
from statistics.
Well, the data for the 2023 drug use, the data for the 2023 drug report will be published on the 26th of June. So that was where we get the latest information. But one of the states with the highest prevalence is Gombe, which is like the key to the northeast. So it's like a transit state where a lot of drugs flow into the states before it's being passed to the other states. So I believe that the governor of Gombe has a lot to do.
So that means awareness has to start going on there.
Awareness has to start going on there. The Northeast Development Commission have a lot to do.
In your years of advocacy, what is the worst case scenario you've ever seen?
Worst case scenario, I've seen a lot of cases, and personally, apart from advocacy, we do rehabilitation, we do consultancy, we do a lot of things. So some of this information are private information. We have seen a lot of cases, but one thing that I've seen is that I've seen cases that were so scratched out, cases that were so gone. I've had cases of girls that left the house, they were in the bunks, we had to bring them out of the bunks, we had to be with them, and I've watched them turn around. I've seen people that look like broom become chubby. People that look like broom, like they were dried out, and they became chubby. I've had to bury friends.
Wow.
I've watched mothers cry. I've escorted mothers to the mortuary.
Wow.
Yeah, I've done that. It's been a wonderful journey. Escorted mothers to the mortuary to identify children. I've gone for burials. But I've seen people that were down get back on their feet and make a difference. And I'm one of those people.
Of course.
So I believe that there's still hope. I believe that we need to stop discrimination. We need to stop the stigma and give those people that are still struggling to come out a chance.
What advice would you give to parents? Because I know we can be very dramatic.
If you're a parent listening and you're watching this, I would say that God has put a precious gift in your hands, and it's your responsibility. Regardless of all the other things that you could do, show your child a little more love and be there a little more for your child. Try to pick up on your child's needs and respond as much as you can. They need you.
I want to say a very big thank you to you for coming
pleasure.
On the show
Thank
and
you.
Educating us about illegal substance, which is drug abuse. And good luck and congratulations too about the way you help kids, especially going down to the cradle to tell them about the disadvantages of drug abuse.
Thank you so much.
And I hope you'll come here next time when we call you.
I'm available.
Thank you very much.
It's a pleasure.
Our guest has been Ambassador Kenneth Anetor, the Executive Director of a New Thing International Foundation with almost a decade of experience in the non-profit sector, a certified trainer of United Nations Office on Drugs and Crime. He was awarded a certificate for understanding addiction, identification, counseling and treatment of opioid use disorder from Harvard Medical School. In April 2023, Ambassador Kenneth Anetor was appointed as an ambassador of the Federal House of Representatives Committee on Narcotics Drugs in recognition of his humanitarian and outstanding service to the nation of Nigeria. He has a diploma in transmental health and is currently enrolled in a transmental health master's program at El Rohin University, London. On the 25th of March, Ambassador Kenneth Anetor was awarded the African 40 Under 40 Honorary Award for Drug Abuse Control in Africa. Are you a woman who is addicted to drugs? The truth is that it doesn't just affect you, but also it affects your loved ones and anyone around you. Getting out of it won't be an easy walk, but going forward, you can kick drug addiction and live a life of purpose. The very first thing to do is the willingness to seek professional help. Find a support group, plan a life of healthy habits, attend regular counseling and therapy, get involved with a hobby, practice self-care and create a positive environment for yourself. And please, if you have an addict around you, do not stigmatize them. Show them empathy. The government is advised to develop a strategic national plan targeted at tackling high unemployment among women and girls to reduce the menace of drug abuse. That's the much we can take on the program today. Join us same time next week. Bye-bye.